This is my assignment for PTP 646. It's patient education for a patient who has cancer-related fatigue. My patient is Lawrence. He's a 67-year-old male with kidney cancer. He had surgery to remove a tumor and is now undergoing chemotherapy and has fatigue levels. He's particularly fatigued in the evening. So, Lawrence, I'm going to talk to you about fatigue and how to manage it and how, physical therapy can help you. Okay? So first, there are some techniques and some strategies that I can give you to help you manage the fatigue throughout your day and throughout your week. And we refer to them as energy conservation techniques. So it's basically a bunch of little tricks to try and save energy throughout your day.
Okay.
So first of all, whatever you would normally do physical activity throughout a day, you need to kind of lower your expectations for what you're able to do, since you are in chemotherapy right now and the cancer treatments are making you really fatigued. So before, if say you would mow the lawn and clean the garage and do housework, maybe you would only pick one of those activities for the day, that do only one busy activity in the day. Okay, so that sounds like something you can work on?
Yeah.
So then another thing is, throughout your day, paying attention to your fatigue levels and pacing yourself. So when you start to feel tired, or you want to stop and take a rest break, you don't want to keep going, so then you're so fatigued you can't get off your couch at night. Okay, so you want to pace the way you're feeling throughout the day, and take a break when you can. And then other techniques referred to as energy conservation is if you're doing something where normally you would be standing, but you can do sitting, grab a chair and sit, conserve your energy where you can. It can really help. All these little things can add up and really help you, feel better overall.
So I could take a chair out when I'm pruning my roses?
Yeah, definitely.
Okay, I can do that.
That would be, a great way to conserve energy, still do things you want to do.
Oh, okay.
And then, has anyone talked to you about actually going to bed earlier at night?
I am kind of an owl. I like to watch late night.
Well, and if do you have a DVR or something like that?
I sure do.
Maybe you could start recording that and trying to go to bed a little bit earlier. Even 20 to 30 minutes earlier at night can help you feel better the next day and less tired.
If I can feel better, I'd do that.
Yep. And then the other thing is, you mentioned to me that you're more fatigued at night, which is natural.
Yeah.
So you could plan, more physically demanding activities for the morning or earlier parts of the day, so that at night you don't have to be trying to, mow your lawn or whatever. So plan your day out so that you can do your physical activity stuff when you're most energized and ready to do that.
Okay.
Okay?
Yeah.
So, and I have a handout I can give you before you leave with these techniques to kind of remind you, to start thinking about them throughout your day. And then actually another way that's really great to manage and fight cancer-related fatigue is exercise.
Oh.
Now, some people look at me like I'm crazy. They think I'm already fatigued. How am I supposed to exercise if I'm fatigued already,
Sure.
in general? But there's research out there actually saying, it really, really does help. It's just low to moderate intensity of exercise, 15 to 30 minutes a day. And then, of course, they say 3 to 5 days a week, but the more the better. So when you come back to physical therapy, I'm going to start you on an aerobic conditioning program and get you started on that and help you figure out how to do it at home. So for the low moderate intensity, usually it's treadmill walking, get you on a stationary bike or incumbent bike. Or do you have any equipment like that at home, like a treadmill or a bike?
I have a pedal bike.
Pedal bike. Do you think, is pedal biking something that you might be able to do 20 minutes at night or something?
I've been doing it my whole life, so yeah.
Well, actually, I just said 20 minutes at night. Maybe, in the morning might be
Sure.
best for you
Sure.
to do.
Yeah.
So then the other thing to talk to you about is want to get you started on an exercise program. But it's actually, you got to be careful. There's some things to pay attention to.
Okay.
There are some times where I wouldn't want you to exercise. So, is your chemo 3 days a week?
Yes.
Okay, Monday, Wednesday, Friday.
Mhm.
Okay, so you wouldn't want to work out in the same day that you've had chemo
Okay.
because it takes a lot out of you, I'm sure. Not feeling
It
too good
does.
after that.
It does. I come home when I'm tired.
So you'd want to try and wait 24 hours if you can, but if your chemo is, say Monday morning, is that usually when it is?
Yeah.
So it's Monday morning, you would want to wait till like Tuesday afternoon before you would do some exercise. And we'll plan your physical therapy visits around that too.
That sounds good.
But so you don't want to exercise right after chemo.
Okay.
Now, if you have any kind of infection or a fever, you don't want to exercise. And then do you notice when you're at chemo, do they take your blood counts? Have you noticed them telling you like, oh, your blood counts are normal or they're low?
They do a lab draw.
Okay. Well, that's something we can have you ask, what do my blood counts look like? Because if they're low, you're probably not going to be feeling too good anyway, and you wouldn't want to be working out.
So when my blood counts are low, that's when I feel less energetic.
Typically.
That makes sense.
Yeah.
Okay.
And I can actually consult with your physician on your lab values, see what they're looking like, because that'll be important to, if we need to manage any of your blood levels with medication or anything like that.
Okay.
Yep, so, and then the other time I wouldn't want you to work out is when you're just really, really feeling lousy. Like if you, wake up one morning or in the afternoon, whatever, you just don't feel good, you feel sick, that would not be a day to work out. Okay?
Okay.
But we'll get you started on an exercise program when you come back to PT in 2 days, and we'll talk more about, integrating a program into your life, and hopefully that with energy conservation techniques will help you, manage this fatigue through your cancer treatment.
Well, thank you, Michelle. I appreciate that.
Do you have any questions for me right now? I know it's a lot of information to take in at once.
No, I think I'm ready to get started.
Okay, good. Well, I'm really looking forward to working with you, and I will see you later.
Thank you very much.
All right.